Well, good morning, everybody, and you're very welcome to join us for this webinar on the challenges facing childcare in England in the context of COVID-19. I'm Paul Johnson, I'm Director of the Institute for Fiscal Studies, and I'm delighted to be welcoming you to this event. A terribly important set of issues which we've not seen so much coverage as the rest of the education system over the last several months, as schools have reopened, as we've had the debacle around exams, as students are going on to universities. The issues facing childcare are just as serious as those facing other aspects of the education system in England at the moment. So I'm particularly pleased to be welcoming some of the authors of today's report to be talking about that just now. We're going to start off with Christine Farquharson, my colleague at the Institute for Fiscal Studies, who will be talking about what happened to childcare during lockdown. We'll then move on to Gillian Paull from Frontier Economics, who will be talking about the risks the sector faces over the coming year and what government might do to address them. And then Megan Jarvie from Coram Family and Children, who will be looking at what's described in my notes as a more on-the-ground aspect of or perspective on what's happening to childcare, how parents and local authorities are responding to some of the challenges. All of what you see today is written up in a report which is available on the IFS website. We at the IFS are particularly grateful to the Nuffield Foundation for funding this work, which is a part of our annual review of education spending in England, additional parts of which will be coming out later in the month, looking at schools and the higher and further education sectors as well. This year, of course, we're focusing on the impact of COVID-19. Each of the panelists are going to speak for about 10 minutes. If you have questions, please do ask them on Slido. You should have Slido details with you. There'll be plenty of time for the panelists to respond to those questions after they've spoken. So please do make your questions known via Slido. I'm going to stop the introduction at that point, welcome all of you once again, and hand over to Christine, who will, as I say, start by describing what's happened to the childcare sector through the lockdown period.
Thank you very much, Paul. So as Paul says, I'm going to start by talking about what's happened to childcare during the lockdown, and in particular, what that means for childcare providers' finances. On the 23rd of March, at the same time as school children were told to stay home from school, childcare providers were also told that children broadly were not allowed to go to childcare anymore. The exceptions were children who were classed as vulnerable and children who had a key worker as a parent. That was actually quite a lot of kids. It was about 40%. Particularly because of the key worker exemption, but in practice, very few children took up childcare during the lockdown, fewer than 100,000 even at its peak. Childcare settings were asked to stay open if they could in order to keep looking after the kids of key workers and vulnerable children, and statistics from the Department for Education say that around a third of providers did so. Since the start of June, all children have been allowed to return to childcare, so it wasn't a phased reopening in the way that we saw for schools. And that's made quite a difference. The number of children attending childcare has about quadrupled, and so right before the summer holidays, it peaked at just over 400,000 children. The problem is that before all of this happened, around 1.4 million children were attending childcare on any given day. And so that means that even at that pre-summer holiday peak, take-up of childcare was only 30% as high as it was before the crisis. And for most providers, when children stop coming, parents might stop paying their fees. And so this is really a very significant hit to the income of a lot of settings in the sector. To help with that, the government has introduced a wide range of different support packages. One of the most important is that the government's continued to fund the free entitlement, so publicly funded free childcare hours, at the same level as they were funded before the crisis. Providers were also able to access more economy-wide schemes, such as the furlough scheme for employers or self-employment grants for childminders and other self-employed providers who had lost out on income during the crisis. And so that means that providers who were mostly publicly funded were broadly well protected, and there was other support available for some of the costs of other types of providers. There were, of course, questions about how these schemes fit together, and broadly the rule was that you weren't allowed to double dip between the furlough scheme and the public free entitlement funding. So if you had a staff member who was delivering free entitlement hours, and you were continuing to get income through the free entitlement funding, you weren't supposed to then also apply to furlough that staff member with more public funding. That's quite a sensible distinction, but in practice, there were inevitably going to be gaps in how those two different programs lined up. And so some settings weren't able to fully access the furlough scheme. The government also had a wide range of other sources of support, including a business rates holiday for nurseries, as well as general programs for the broader economy, like extensions to the generosity of universal credit, grants to small businesses, government loans, deferrals of tax, and in some local authorities, specific support packages tailored to the childcare sector delivered by the local authority. So taking that together and comparing it to what the situation was going into the crisis, around 27% of childcare income in the sector came from the free entitlement funding. And so that's broadly continued at the same level as it was before the crisis. But 64% of providers' income came from parent fees and charges. And this is where there's a real risk that much of this income has dried up. We can't say exactly how much because we haven't surveyed any providers directly, but this is where a lot of the financial risks to the sector are coming from. We can also look at providers' costs and what that means for the amount of support that they're eligible for. Far and away, the biggest cost in the sector is staffing. That's around 70% of total costs in the sector. And there was some support for this via the furlough scheme, at least for employers. But that still left many providers facing, quite substantial costs for things like rent or insurance programs that broadly they would still have been liable for during the lockdown. So in our report, we pull together information from all of these different sources based on data about providers' income and their costs from a nationally representative survey conducted in 2018. And we model what providers' finances might have looked like during the lockdown. Now, the biggest uncertainty here is we can't say exactly what happened to income from parent fees during the lockdown. So we look at two scenarios. The first is really pessimistic and assumes that all parent income dried up completely. Providers had no income from parent fees during the lockdown period. The second, still pretty bad scenario, is that 85% of parent fees went away during the lockdown, but providers were still able to keep 15% of that income, for example, through charging parents retainers or through providing childcare to some of the kids who were still eligible for it. And in both of these scenarios, we incorporate continued public funding and support through the furlough and self-employment schemes. Since the data doesn't tell us about providers' business rates, we're not able to take into account that particular form of support in our modeling. And we assume that providers are still going to be responsible for the other costs. Based on that modeling, we construct something called the income to cost ratio, which is the number of pounds of income for every pound of costs that a business has to pay out. We divide providers into three different groups. The first group, in gold at the top of the chart, are providers who are running a significant surplus. So they have more than 6 pounds of income for every 5 pounds of costs that they have to pay out. The second group, in the kind of lighter green at the bottom of the chart, are providers who are in a significant deficit. These are providers who have fewer than 4 pounds of income for every 5 pounds of cost. And the group in the middle, in this sort of dark green, is quite a broad range, but centered around the breaking even point. So providers with between 4 and 6 pounds of income for every 5 pounds of cost that they have to pay out. What we find is that in our no-fee lockdown scenario, around a quarter of private sector providers, the 26% at the bottom left, ran the risk of being in significant deficit during the lockdown with fewer than £4 of income for every £5 of cost. That's pretty substantial. And the group that really stands out on this chart are childminders, where it's almost 2/3 in this scenario with less than £4 of income for every £5 of cost. Now, it's important to say that we've modeled childminders in the same way as we've modeled other types of providers in order to improve comparability across them. But in practice, for childminders, one of their biggest costs is the amount of childminding income that they themselves usually earn. So the amount that they have left over from their business to pay for things like their mortgage or their shopping trips. And we assume in our modeling that childminders want to continue to pay themselves the same amount. Now, in practice, some childminders are going to be able to cut back on the amount of their own income during this crisis. But what the 64% really highlights is that a lot of childminders are facing a really big trade-off between their own personal financial health and their ability to continue to run a financially viable childminding business. Of course, not all of the deficits that we see during the lockdown are because of COVID. Even going into the crisis, there were a lot of providers in the sector who already had weak finances. You can see for example, in the nursery classes sector, around a quarter of providers were in significant deficit during the lockdown, but actually that was entirely explained by the quarter of providers who were in significant deficit even before COVID hit. Where things have really changed during the lockdown are particularly in the private sector, where we went from having around 11% of providers in significant deficit to potentially as many as a quarter, so more than twice that share. All of this begs the question of what's driving some of these differences between provider types that we see. The first explanation, of course, is the finances that providers went into the crisis with. For nursery classes, those entirely explain the patterns of deficits that we're seeing. For childminders, around half of that 64% of providers in deficit were already in deficit going into the crisis. But it doesn't explain everything, and particularly in the private sector, we see that 7% of providers had a really substantial surplus before the crisis, so they were very financially healthy, but have been tipped into a significant deficit and have really fallen quite far as a result of the lockdown. The second explanation is the different sources of funding that different providers take in. One of the reasons that nursery classes have seen so little change during the lockdown is that they're basically almost entirely funded by the free entitlement, and so their income has remained essentially unchanged. Their costs have also remained essentially unchanged through the crisis. On the other hand, childminders are getting around 3/4 of their income from parent fees, and so they're much more exposed to the potential risks of that income drying up if parents stop sending their children to childcare. The final difference between provider types that we look at is the extent of government support, in particular support through the furlough scheme and the self-employment grants. So in this chart, you're seeing the replacement rate, so the share of baseline fee income that is covered by payments through the furlough scheme or through the self-employment grants. And what we do is we line providers up on the basis of this replacement rate, and then we look at the providers who are 1/4, 50%, and 75% of the way down that line in the purple, the yellow, and the green respectively. At the median, for the provider who's sort of in the middle of that distribution, the furlough payments for private sector providers replace around half of the loss of baseline fee income. For childminders, it's slightly higher, so the self-employment grants are replacing about 2/3 of their baseline fee income. And you can see that when you go further up the distribution, the self-employment scheme can replace really a pretty significant amount of childminders' baseline fee income, over 80%. So to sum up, in our research, we find that providers saw a significant financial hit from the lockdown. And for example, we're seeing now twice as many private nurseries in significant deficit as we had before the crisis. It's important to emphasize that this would have looked a lot worse without government support, both through the furlough scheme, the self-employment scheme, and through continued funding for the free entitlement. Even so, providers who relied on income from parent fees were a lot less well protected than those who basically saw their public income unchanged. That means that private providers and childminders have broadly been harder hit, while nursery classes have, at least so far, escaped relatively unscathed, at least compared to their baseline finances. I'm now going to hand over to Gillian and Paull to tell us about what this might look like going forward once some of these government schemes start to be phased out.
Great. Thanks very much, Christine. Good morning, everyone. I'm now going to look a bit further forward on what might happen to childcare provision in the sort of the post-lockdown period. And I'm going to talk very briefly about three things. I'm going to say what might happen to providers' finances as government support ends and as parent demand may or may not recover. I'm then going to talk a little bit about the longer-term risks in the market in the nature of provision. I'm also going to talk a little bit about why and how government might want to intervene to support provision as we move forward. So at the moment, there are two sets of key challenges that will face providers in the next few months. The first one is around the end of government support, as the furlough scheme is wound down towards the end of October, and also the SEISS scheme, which has been supporting childminders, will be wound down. In addition, from January 2021, the free entitlement funding will be based on attendance rather than on pre-crisis child numbers, which will mean that the free entitlement funding will no longer be protected against drops in demand for the free places. The other challenge that providers face is how much and how well the parent demand for childcare will recover. On the one hand, we will obviously expect some recovery in demand as the furlough scheme ends and there's a call for workers to return to the workplace. We would expect parents to be returning to work and needing to use childcare again. On the other hand, there's several reasons to believe that the demand for childcare might be lower than it was pre-crisis. So those reasons include that health-related concerns for children might mean that parents don't wish for their children to be in childcare, or the higher unemployment rates as the economy recovers might mean that fewer parents need childcare in order to enable them to work. And in addition to that, more parents might actually continue working at home after the end of the lockdown. And that will mean that they may need fewer hours for childcare or may decide that they can manage without childcare at all. So we've estimated the possible impacts on provider finances of these two challenges going forward. And to do this, we use scenario modelling because we know what will happen to government support, but we really don't know what's going to happen to parent demand. So because we don't know exactly what will happen, we've considered a range of possibilities for what might happen to fee income and free entitlement funding going forward. We also assume that in this immediate scenario that there's no change in cost, that providers don't adjust their provision in the short term that we're looking at here. So the way we estimate these impacts is we use the same data and the income to cost ratio that Christine's just been describing for the lockdown estimates. However, we assume now that all furlough and SEISS support has been removed, and we test the impacts of the lower fee income in 5 increments. They are a 5% drop, 10%, 15%, 20%, and 25% loss in parent fee income. We then also test the combined impact of lower parent fee income with a drop in free entitlement funding if demand for the free places should fall as well. So this first graph shows how providers' finances have been affected under the different scenarios for lower fee income. And it shows the proportion of providers, again, in significant deficit and in significant surplus for the baseline, and then the 5 different scenarios about changes in parent fee income. What we can see is that for every 5% increment in lost income, there's an additional 3 to 4% of providers who are in significant deficit. And under our central scenario of a 15% loss in fees, there's an increase from 28% to 38% of providers that are in significant deficit. So even under just a loss of 15% in fees, we see a significant number of portions moving into potential financial difficulties. If we combine that with a loss also in free entitlement funding, this graph shows the combined effect of those, again showing the baseline scenario where we started, and then the combined effect of a loss of income from parent fees and from the funding from the free entitlement, moving up again in the same 5% increments. In this case, every 5% increment in lost income leads to an additional 4 to 6% of providers in significant deficit. And that compares to the 3% to 4% change that I showed in the previous graph. So on the face of it, it doesn't seem like that adding in the potential effect on free entitlement funding has a huge impact on the potential financial risk to providers. However, we do need to consider the impacts vary across different types of providers, as Christian has just shown for the case of the lockdown scenario as well. So for private providers, lost fees and lost fundings have similar impacts. So this graph shows the baseline scenario. The middle column shows what would happen if we had 15% loss in fees, and the final column shows if we had a loss of 15% in fees and funding. And as we can see, the proportion of providers in deficit increases from the baseline of 11% to 13% with just fees lost, and to 16% with fees and funding loss, showing similar impacts for both. However, the picture is quite different for childminders, and the fees have a much bigger impact on childminders than the loss of funding. So from the baseline of 36% in deficit, we see that half, 50%, are estimated to be in deficit if the fees are lost, but there's very little change in this proportion if funding is also lost to the same extent. The picture is different again for voluntary providers and nursery classes. Here, the lost funding has a much bigger impact. So for voluntary providers, the 9% in deficit at baseline increases to only 12% for the lost fees, but jumps up to 20% if fees and funding are lost. For nursery classes, the 25% at baseline increases, well, it doesn't increase at all. It remains the same at 25% for the fees lost, but rises substantially to 42% for if there is a loss in fees and funding. And as highlighted in the lockdown scenarios, this reflects the differences in income sources across the provider types. And that's an important point to bear in mind when I talk a little bit later about what government might do to support the sector. So let me turn now to what the longer term challenges for childcare providers are going to be. And I don't have any more numbers to show you, but there are a number of very important issues that need to be considered as we think about what the role for government might be. So a first set of longer term challenges revolves around the demand challenges and the drop in demand from parents for childcare. So first of all, providers will need to think about how they might need to recover from the losses of lockdown, but they also might face the permanent income loss if demand does not recover at all. In addition, there may be a challenge if demand changes for different types of childcare. So possibly we've seen some indication that parents may actually have a preference for more smaller types of settings, or even, for example, moving to childminders, which they may view as safer in a post-COVID world. The other set of challenges for providers is around managing delivery with COVID-19, in particular the new regulations and restrictions that might be required upon them. So the staffing restrictions and even staff absences due to illness could increase their costs. The limited interaction with parents could inhibit their ability to obtain new business. And also the limited interaction with specialist staff could reduce the quality of care that they can offer. And the final set of challenges facing childcare providers is around the risk of future local or national lockdowns, particularly if these were to occur without a furlough scheme or SEIS support. And even if there was continued free entitlement funding, it should be noted that would only support certain kinds of providers. And it should also be noted that even the risk of lockdowns without government support, even if they don't actually happen, could impact on investment in the sector going forward. Of course, providers might respond to these challenges, and we've identified several ways in which they could possibly address these new issues that they face. The most obvious one is they may increase fees for parents, and this would simply make up for the shortfall in income that they face during lockdown and potentially face going forward. This is a quick and simple change for providers to do. However, providers may be limited in their ability to raise fees by parents' inability to pay more fees during economic downturn. Or it may be less feasible for providers to increase fees in areas which are less affluent or have been more affected by the economic downturn. The other way in which providers might respond is they could adjust their business models, and they can do this in several ways to help revive their financial sustainability. They could change their mix of parent paid and funded hours. For some providers, one type of funding is more profitable than another. They could switch provision to more profitable children. For example, they could change the mix of ages of children that they cater for, or they could even select children who are more profitable because they may not have special needs and such high costs. They could switch to lower cost staffing which usually means less qualified staffing and obviously may raise concerns about the quality of care. Or they could reduce the flexibility of hours offered to parents to reduce costs, and that may have implications for parents to find care that can meet their work requirements. Finally, providers might respond by reducing capacity. And if there is a long-term decline in demand for childcare, then it would be natural for the sector to align capacity with that lower demand for the sector as a whole. And that could happen in two ways. One, providers could offer fewer hours or fewer places. On the other hand, more settings could close and fewer could open than was happening in the pre-crisis. In other words, we could see the natural turnover in the market move towards having fewer settings. So this raises the question, should the government intervene? Well, first of all, it should be noticed that the government already intervenes to quite a large extent with a range of policies. And it does this for two reasons. One, to support child development, possibly because parents underestimate benefits or desire to address socioeconomic inequalities. And it also does this to support working parents, particularly mothers, with an objective of addressing gender inequalities. The question is whether the market will adjust optimally to the new demand and cost conditions. We do know that there's high turnover in the market, it's quite flexible, and we've also seen the market respond pretty well to substantial changes in policy and context over the last few years. So the question becomes whether the sector now needs additional support because of COVID. One reason why it might need additional support is if the fall in demand is temporary, then we might want to have additional support to avoid the cost of a lot of settings going out of business and then having the costs of restarting. That is obviously a generic issue that applies to many sectors across the economy at the minute. To what extent do we protect the economy for the longer term return? But a second reason for the childcare market is that the existing reasons for government intervention may have become more important. For example, if providers do react in ways that lead to a decline in quality or flexibility, we may need additional government support if you'd like to address that. In addition, educational benefits may be hidden under health concerns, or we might actually be concerned that the loss of childcare is most harmful for more disadvantaged children, and therefore we have equity reasons to intervene in the market. The final reason for government intervention at this time may be to support specific parts of the market. So the lockdown and its consequences may have reduced access in some specific communities or for some types of children in particular. And again, for equity reasons, the government might wish to intervene to address those differences in impact. It might also wish to intervene to ensure continued delivery of the specific provision of free entitlement as well. So if the government was to decide to intervene, what are the options that the government could consider using? Well, the first couple of options are sort of related to temporary transitional factors. So it could offer more support during further lockdowns. One option of that could be continued free entitlement funding, although we know that would only benefit certain types of providers. And so it might wish to consider other elements such as temporary grants or furlough schemes. The government could also consider using transition funding for the new COVID-19 requirements, for example, grants for providers to cover the cost of one-off adjustments. The other thing the government could do is to try and help providers with their costs going forward. And that could both involve reducing startup costs for providers, or it could involve policies to help reduce ongoing delivery costs. And one of the options for reducing ongoing delivery costs is potentially relaxing the child staff ratios. Although with any relaxing regulation, that obviously has to be weighed up against any potential effects in the quality of care for children. Another area where the government could consider taking action is to boost income, either from the parent paid fees, possibly using a public campaign on the safety of childcare and the benefits of early education and to encourage parents to continue childcare, or using financial incentives by increasing subsidies and tax-free childcare or universal credit. It could also boost the public income for providers, possibly by increasing free entitlement funding rates, although as we've said several times now, that would have limited support for some providers. Or it could do it by increasing supplements for some type of children. If it felt that disadvantaged children and those with special needs were being particularly hard hit by the consequences of COVID, it might wish to step in and take action for those groups. Finally, it might be worth considering investing in maintained provision. So, for example, encouraging more nursery provision in schools, which might create more stable capacity, which might be more robust to future lockdowns or downturns. So in conclusion, the greatest challenge for the childcare market going forward is whether parent demand for childcare will recover to its pre-crisis levels. As we've shown, childcare has faced the greatest loss of income from parent fees, but it should be kept in mind that voluntary providers and nursery classes will be harder hit if the take-up of free entitlement places does not return. So is increased government intervention needed going forward? Maybe not. The childcare market does have significant turnover and it has shown its ability to adapt to a changing environment. However, higher funding rates could help ensure the uninterrupted delivery of the free early education entitlements. However, the hardest hit providers may be those more reliant on parent paid fees. And that suggests that a broader range of other policy options may need to be considered because they could be more effective in helping the childcare market meet the challenges presented by COVID-19. And I will stop there and now hand over to Megan to look a little bit more from the ground view about parent demand and what local authorities have done to help support the local childcare.
Thank you, Gillian. That's great. And yes, as billed, I'm giving the on the ground view. And the reason that I think that this is quite important to consider is, as Gillian and Christine have outlined, what is so key at this pivotal moment is what happens with parent demand. And so what I would like to do is talk a bit about how parents have experienced the childcare market pre-lockdown, through lockdown, and as we emerge, and what that could mean for how demand changes over the coming months and years, and what that means for the sustainability of providers. The key thing is we don't know how long the squeeze on demand is going to last. It's very hard to predict what happens next. Parents are unpredictable in how they're going to make this decision, and that makes everything much more difficult. And the reason for this is childcare is a public policy issue, it's a markets issue, but more than anything, it is a really deeply personal issue for parents. It's about our values for how we look after our children and who we want to take over that role when we're not there as parents. And it's a lot about our own upbringings. So that's why it's so difficult to get under the bonnet of some of these findings. So the situation we were in pre-lockdown is childcare use was very high. A lot of families use childcare. The free early education entitlement for 3 and 4 year olds was used by the vast majority of children. It wasn't quite at universal levels, but we were definitely getting there, and it was considered to be the norm. There was a little bit of a way to go with free early education for 2 year olds, but again, the uptake had been increasing. However, on the other side, the paid for childcare that typically allows parents to work, use was still high, but we saw a greater divide between which families it was that was using that. It was prohibitively expensive, and it is still prohibitively expensive, at about £5 an hour per child. For middle and low income households, many found that the sums simply didn't work for using that childcare. And so they were either making use of informal childcare, shift parenting, or parents were frozen out of work completely. We also know that, as has already been outlined, childcare providers were hard pressed, or many childcare providers were hard pressed and struggling to balance the book. And within that, we talk about whether there's a possibility to reduce staffing costs. The childcare workforce is painfully underpaid in a lot of cases, not universally, but again, in a lot of cases, painfully underpaid. So what we saw during lockdown was the childcare experiences of families being thrown up in the air and the pieces coming down in all different directions. Well, that's what we're seeing at the moment. So for a majority of families, all formal childcare was disappeared. It wasn't possible to use. And so a lot of families turned to that shift parenting approach, trying to balance work and juggle childcare. We saw a slightly different experience for key workers, where use of informal childcare and shift parenting is higher anyway. And many of them were using formal paid for childcare for the first time. There's a bit of a switch around. And it'll be interesting to see how those changes through lockdown affect decision making in the longer term, about whether, having tried things a different way, we actually stick with the different situations that we've tried. One of the important factors during lockdown was the informal childcare almost completely stopped because of the social distancing measures. It's really important to consider the role of informal childcare on the impact of the childcare market more broadly. Pre-pandemic, around a third of families were using informal childcare each week. So it's a big part of this picture. And that did completely stop. And again, there's a lot of uncertainty about how decisions about informal childcare are going to be made as we emerge from lockdown. That it's a difficult decision around, because we know there's some reluctance to use childcare settings, and so informal childcare might seem a more preferable option, but that's also got to be balanced with concerns that parents have about their own parents, the children's grandparents and their children. As outlined, the build-up of demand so far has been slow. There seems to be quite a universal recognition that this month, September, is going to be really pivotal for understanding what's likely to happen with childcare demand over the autumn and winter. And how quickly this demand picks up is in part determined by the economic situation, what happens with employment levels, whether there are jobs for parents to do. But I think that parents' decision making will also play a really large role in what happens with demand. The decisions that childcare providers are making about what they do with parents' fees and staffing are likely to have some effect. We know that for some parents, they really only see marginal gains from going out to work and paying for childcare. So even slight rises in fees, which I think are a distinct possibility, could make it seem not worth it for parents, and that actually might not be able to work even with just a small rise in fees. But the biggest factor is this trust issue, and that's key to how parents make these decisions. Do they trust the individual childcare provider where they're considering leaving their children? And this, it feels quite intangible and distant, but actually there is a role that public policy plays with it. It's driven by access to information. Our work with parents found that they really wanted to know information from individual providers about what they were doing to protect their children's safety. So trust and information is always a huge issue for parents. It's always what they want from providers, to know about exactly how it works and what will happen while their children are at nursery or at the childminders. But now even more so, the demand is there even more strongly. For about a decade, we've been running Parent Champions National Network. Parent Champions are parent volunteers who go out and talk to other parents about the benefits of early education and childcare. And what the experience of running this programme for such a long time has shown us is the many, many barriers, the social, emotional, cultural barriers that families face to using childcare, and that it's an ongoing piece of work to overcome these barriers and to help parents understand and feel comfortable about the use of childcare. But what we've also seen is that parents' choices are responsive to information provision. There's been a wide range of work that's gone on by different third sector organisations, by government, by local authorities, to help parents understand what childcare and early education. And we have seen that it's worked. Uptake has increased over many years. It's taken a lot of work. And it feels to me that this is where intervention could be most useful, mainly because it helps to achieve the goals around early education, but also because it has the knock-on effect of helping the sustainability of providers. And I think when we're talking about parent demand, it's really crucial to think that we're talking about not just children returning to childcare, but children starting to use childcare. And I know that's always there, but I think it's different from the schools discussion, because children use childcare for a much shorter period. The ratio of new users to returners is much higher in the early years. And also, although most families stick with one childcare provider, the movement between different childcare providers is higher than the movement between different schools. So there's that ongoing decision about starting and stopping childcare or using different childcare that happens. I'm in a quite strange position at the moment of I'm working on childcare policy during COVID. I'm also looking for childcare. My maternity leave and my partner's shared parental leave has ended during lockdown, and so we've had this very hands-on experience of what it's like to try and find childcare at this time. And it's really tricky, and it's very hard to be rational, even when you've got all the knowledge, access to knowledge that I feel like I have. If settings were allowing us to look around, I would start questioning what that meant about safety and quality. If they weren't allowing us to look around, then obviously we didn't feel able to leave a child there. We were never able to visit settings together, and we were only ever being able to look when the settings are closed and then there are other children there. And this, I understand that situation, it makes sense. And I don't have experience of looking for childcare in normal times, but I can't help to feel that it would have been easier in different times to get a sense of the setting and to be able to build that all-important trust that's so important for parents when using childcare. And if I'm completely honest, if I wasn't working a job that I really enjoyed, I might have waited a bit longer to use childcare. And this is where I think that this becomes the parent demand is really a public policy issue. It has taken years and years of work to get to a point where children from low-income households are almost, still not as likely, almost as likely to take up early education as their peers. And I fear that the pandemic is going to push that back. I think that households where both parents or one parent, if there's just one single parent households are working, are much more likely to use childcare again, because the alternative is really, really exhausting, I can tell you that. But where there's a lower work intensity, and that often means a lower income, I think uptake return is likely to be slower, because there's a different push, there's different factors that inform that decision making. One of the key aims of early education when it was first introduced now is to narrow that achievement gap between disadvantaged children and their peers that opens up before they start school. And so there is a real issue that needs to be considered about how do we make sure that the disadvantaged children are making it through the door and getting there in these more challenging times. So there's a lot of complexity around what's going to happen around parent demand and whether families are going to return to childcare. And that's what's going to be so crucial for determining what happens with the childcare market in the future. It's very clear that it doesn't make sense for a provider to close down for a new one to have to open up in a couple of months' time when demand picks up, and that there should be some kind of solution to prevent that from happening. What that solution is much, much, much more difficult to understand. Loans seem to be the obvious solution, but I have real concerns about the cost of loan, who will bear the long-term cost of loans and the impact that they'll have on the financial sustainability of the sector. I think it's likely to be parent fees. Childcare providers, as has been very clearly shown already, have taken a loss during lockdown, a big loss that has to be made up. And I think the parents are really at risk of carrying the can on that one. We have a hybrid system between public and private providers and funding in our childcare market, and that makes it very difficult to determine what to do next. Government have attempted to treat early education, or have treated early education similarly to schools, and continue to fund early education regardless of attendance. But because the chosen providers are largely also reliant on private fees to be able to deliver the early education places, there's still a risk that those places simply won't be there because of the threats to financial sustainability for childcare providers. And there's also this concern around there's a minority, it's a small minority of childcare providers that are making a very healthy profit, even during lockdown, and that doesn't feel like the best use of public funding. There is use to it, but perhaps not the best use. So how to intervene is the key question here that Gillian gave some very, very useful insight on. I would like to just raise the issue of local authorities, who I think who are going to be incredibly important for determining that issue of how to intervene. They're a very important part of the childcare structure and market. They really understand what's happening in local providers and local demand from parents. We must remember that the childcare market is hyper-local and that families are looking for childcare providers within a couple of streets of where they live, not right across their borough. And so you need to be able to have a response that recognises this and meets this need. And we've seen some local authorities really doing a lot to support the market and also to understand what's happening through COVID-19. So we've got the example of Birmingham have a funding package that has really helped to meet the needs of those providers locally, and Brent have done a lot of work to really understand demand on a hyper-local level. And I think the best tailored package of support will really make use and mine this knowledge that's held by local authorities. It's right that the market is adaptable and that we have seen it adapt to the many changes that have been thrown at it, and something will weather this storm. However, we need to really consider the cost that comes with asking the childcare market to continually adapt and change. Childcare providers have already reported feeling battered by recent changes in policy and struggling with funding levels and with financial sustainability. So we need to make sure that when we're thinking about what intervention is needed, it's not just about survival in any form, but about what do we actually want that childcare market to look like and how can it best meet children and parents' needs. So part of that is about thinking about how do we make sure childcare does not become exclusively for better off families, and how do we make sure that parents have a choice about the different types of providers that they would like to use. The diversity of the market is very important for families. And how do we make sure that the workers that are caring for and educating young children get the pay and respect that they deserve, because that is also very much under threat as childcare providers try to make sure that they're balancing their books and are sustainable. Okay, thank you.
Well, thank you very much to Christine, Megan and Gillian. We've still got a few minutes left for questions, and there are a number of those on Slido. If you have any others that are burning, please let us know. Shall we start with one question here from an anonymous person writing in. This interesting question, I think, is the end result more provider consolidation? I don't know if any, I don't know if we can answer that, but it feels like quite an interesting question to mull over. Would any of you like to provide some thoughts on that one?
Yeah, I'm happy to jump in there. I think the idea about provider consolidation is often to do with economies of scale and reducing cost of provision if you have bigger providers or you have chains of providers. In particular, that chains of providers can sometimes sort of take out some of the administrative costs and reduce sort of overhead costs. The evidence we have on that doesn't particularly support that as a strong argument. We don't particularly see that delivery costs are lower for larger providers, nor do we particularly see that chains have lower costs either. And I think there are also, issues around quality of care and choice for parents around if you did have big provider chains or consolidation. So I think on the face of it, no, we don't have any particular strength of argument to say that consolidation is necessarily an idea that would particularly help childcare provision at this point in time.
We don't. I mean, another reason you might get consolidation is trust in a brand. I mean, it might help Megan find a nursery she trusted if there were a few brands out there that people really trusted. Is that there's no sign of that in the market either?
I think there's also the desire for variety. So what we know from families is that there's actually a different solution for individual families. Things that we think is really important in the market to have the diversity, and consolidation doesn't mean that stops existing, but it's something that has to be balanced with making sure there are different providers there.
Okay, so another question here. Beatrice has asked if we know anything about whether providers most at risk of falling in deficit are those in disadvantaged areas. I think you did look at that, didn't you?
Yeah, we did. So this is actually a really interesting finding from the report, because we looked at a bunch of different characteristics. We looked at the level of disadvantage of the neighborhood that the provider is located in. We looked at the average level of qualifications that the staff in the setting have. We looked at the size of the setting along the lines that Gillian was just talking about. And surprisingly, at least to me, we don't find a lot of patterns on any of those dimensions. So we don't find that providers in poorer areas are systematically more likely to have gone into deficit during the lockdown. We don't find that providers with higher, better qualified staff are more likely to have gone into deficit either. And that contrasts a little bit with some other research that's been done, in particular into the impacts in disadvantaged areas. There are a whole bunch of different reasons that might be. So much of the other research that's been done is asking providers how they themselves feel and might look at what worries they have going forward rather than kind of coming up with this measure of what's happened during the lockdown potentially. And it might be that some of our modeling doesn't exactly capture all of the nuances. So for example, if childminders in disadvantaged areas are much more likely to be new to the market, to have been operating for less than a year, they might not be eligible for support through the self-employment grants. So our results don't necessarily negate what's already been found, which is that providers in these disadvantaged areas are more worried. But at least on our evidence, we don't find any particular reason to believe that they've been harder hit during the lockdown.
I think one thing that I would add to that is that if demand comes back differently in deprived areas, then there'll be a different impact. Is that right? Yeah.
So the other thing to add as well is that there tends to be more maintained provision in the really most deprived areas. And of course, at the moment, while the free funding entitlement has been maintained, and that was in our modelling to maintain it, our evidence shows that they have not been hit. If that was to change in January, then it's possible that that maintained provision in more deprived areas might be hit by any fall in free entitlement income.
I suppose partly related to that, there's a question just come in from Ashley about if things develop differently in different parts of the country as the economy comes back differently, might there be more of a case for a regionally differentiated set of policies and interventions?
I think my priority for a regional intervention is the idea of looking at what's happening during local lockdowns that we might see going forward. So I think Gillian made it very clear that one of the biggest risks for providers is after this autumn, once the furlough schemes stop, the self-employment grants have stopped, and then come January, once the free entitlement funding is reassessed, what do you do if the parents in your area are told that they can't send their kids to your setting anymore? And at the moment, there's a bit of a plan for what happens for the free entitlement funding. That funding should continue to come in, albeit potentially at the new lower January level if this is happening in 2021. But there really isn't a plan for what happens for the income from parent fees. And so I think the risk of losing local provision is the risk that one particular area goes into an extended local lockdown, and we just don't have the tools in place right now to help providers to get through that.
That feels like an obvious priority. I mean, either that or indeed related to another question that we've got here from Ian Morgan. If we get closures down to positive tests within the childcare setting, I mean, presumably in both of those cases, either because of a local lockdown or because of positive tests within the setting, I think you're saying that at the moment, beyond the government-funded places, there's no formal plan or support in place at all, which could obviously be disastrous for any affected settings.
Yeah, and I think that touches on a bigger issue that when you have sectors in the economy like childcare, which are kind of part of the infrastructure because they underpin and support many other sectors in the economy as well, whether the government needs a sort of overall strategy to help maintain those important kind of infrastructure sectors going forward. and what they do if they are affected either by lockdowns or by, as you say, problems with the workforce issue as well. And I rather suspect that thinking in other areas, the other cases, examples like that is sort of local transport or the like. And really, ideally, there would be a sort of policy for generally maintaining what might be considered essential services. And there's a very strong case that childcare should be in there and considered as one of those essential services.
Well, that feels like a very important conclusion from this. There's another question, which I guess is also related to how things might change in the future, from Neil, about a question of what happens if working from home trends change demand for childcare. For example, parents might feel more able to take up funded hours only. Presumably in that world, we would end up with a smaller and rather differently shaped childcare sector.
Yeah, I think that's right. There is an issue that in one of my slides, the final column was reduced capacity, and that reflects both reduced capacity and shape of the market. We are moving into a different world where the working patterns have changed the demand for care. Then you might say actually it's sort of optimal for the childcare market to reshape itself and possibly reduce itself. I think that then comes back to the questions about why government has been promoting childcare for so long in terms of its child development issues and in terms of its gender equality objectives as well. That if it's actually need for childcare that is reducing the demand or the way people are working, we might then want to think again about whether it's having an impact on those other objectives, including the children's education and early development.
Yeah, and obviously any change along those lines will be one of the many disruptive things happening to the economy and social services in the general sense. Gillian, there's a question here directed explicitly at you, really, I think by way of clarification, asking about what different aspects of the sector you looked at, and in particular what you meant by nursery classes.
Yeah, nursery classes, yes, we should define that. Nursery classes are nursery classes in school-based provision, and that basically almost all of those are maintained provisions. So when we use the term nursery classes, we are meaning in schools, basically. And when we use private provision, that can cover a whole host of preschools, nursery classes, nurseries, daycare, generally.
Great, thank you. As it happens, we come to the end of the questions as we come to the end of our allotted time. Thank you so much to the three of you for three fascinating presentations, and particularly for the report, which I hope those watching will have seen has garnered quite a lot of coverage this morning in the newspapers and on the radio, if you're up in time to listen to Christine this morning. It's a really important issue. It's one that I think relative, as is often the case, relative to schools and universities, has not had the focus that it needs, either from policymakers or from opinion formers and in the press. So I think this is an incredibly important contribution to policy making and the debate in this area. Thank you again to the Nuffield Foundation for funding this, as I said, as part of our broader work on education spending, and do look out for that, looking at other aspects of the education system over the next several weeks. But for now, I just end by thanking all of those of you who have joined us on this webinar. Keep looking out for IFS's events and podcasts and publications. We've got a very large number of outputs on our website now, directly related to what's been happening with coronavirus, and we will continue to be publishing things in that area. So thank you all very much, and goodbye.